Hello everyone, welcome to Bioboard classes. Today we are going to learn about anemia and its different types. Anemia is a condition in which the blood does not carry enough oxygen to meet the body's needs. This can happen because the body has too few red blood cells, the red blood cells do not contain enough hemoglobin, or the cells are being destroyed or lost faster than they can be replaced. In this video, we will understand the major types of anemia, their causes, and their basic features. To understand the types of anemia, let's first understand what anemia means. Red blood cells contain a protein called hemoglobin, which carries oxygen from the lungs to the tissues of the body. When hemoglobin levels or red blood cell numbers are too low, the body's tissue may receive less oxygen. This can lead to symptoms such as fatigue, weakness, dizziness, shortness of breath, and pale skin. Anemia can be classified in different ways, but one of the most useful approaches is to classify it based on its cause or the size of red blood cells. Anemia can be broadly divided into three major groups based on the size of red blood cells. The first is Microcytic anemia, in which the red blood cells are smaller than normal. Second is Normocytic anemia, in which the RBCs are normal in size but their overall number or production is reduced. The third is Macrocytic anemia, in which the RBCs are larger than normal. Now let's look at each type in more detail. The first and most common type is iron deficiency anemia. Iron is essential for the production of hemoglobin. When the body does not have enough iron, it cannot produce sufficient hemoglobin, resulting in smaller and paler red blood cells. Common causes include inadequate dietary iron, increased iron requirements, poor absorption, and chronic blood loss. In adults, chronic blood loss from the gastrointestinal tract or in some cases heavy menstrual bleeding can be an important cause. Common symptoms include tiredness, weakness, pale skin, headaches, and shortness of breath. Iron deficiency anemia is generally classified as microcytic hypochromic anemia. Another important microcytic anemia is thalassemia. It is a group of inherited blood disorders in which the body produces abnormal or reduced amounts of globin chains, which are the components of hemoglobin. Because of this, RBCs may be smaller than normal and may be destroyed more easily. Thalassemia can range from mild forms such as thalassemia trait to more severe forms that may require regular medical care and blood transfusions. Unlike iron deficiency anemia, giving iron is not an appropriate treatment for thalassemia unless iron deficiency is also present. Anemia of chronic disease, also called anemia of inflammation, occurs in people with long-term illnesses or chronic inflammatory conditions. Conditions such as chronic infections, autoimmune diseases, kidney disease, and some cancers can contribute to this type of anemia. Inflammation affects how the body uses and stores iron and can also reduce red blood cell production. This type of anemia is often normocytic, although it can sometimes become microcytic. Treatment focuses mainly on managing the underlying disease. Now let's discuss aplastic anemia. Aplastic anemia occurs when the bone marrow fails to produce enough new blood cells. Because the bone marrow produces RBCs, white blood cells, and platelets, people with aplastic anemia may have reductions in all three cell lines. This can lead to fatigue due to anemia, frequent infection due to low white blood cells, and easy bruising or bleeding due to low platelets. Aplastic anemia can have several causes, including certain medication, toxins, infections, autoimmune processes, or it may sometimes have no identifiable cause. Severe cases require specialist medical treatment. Hemolytic anemia occurs when RBCs are destroyed faster than the bone marrow can replace them. This destruction is called hemolysis. Hemolytic anemia may be inherited as in some RBC disorder or acquired due to autoimmune reactions, certain infections, medication, or other conditions. While RBCs are destroyed rapidly, the body may show signs such as jaundice, dark urine, and enlarged spleen depending on the cause. Treatment depends on identifying and managing the underlying cause. Next is vitamin B12 deficiency anemia. Vitamin B12 is essential for normal DNA synthesis and red blood cell formation. When the body does not have enough vitamin B12, RBCs become unusually large and abnormal. This is known as megaloblastic anemia. B12 deficiency may result from poor dietary intake, problems with absorption, or conditions such as pernicious anemia. An important feature of vitamin B12 deficiency is that it can also cause neurological symptoms, including numbness, tingling, balance problems, or difficulty with memory. Early diagnosis and treatment are very important to prevent potentially permanent nerve damage. Folate deficiency anemia is another type of megaloblastic anemia. Folate, also known as vitamin B9, is necessary for DNA synthesis and normal red blood cell production. A deficiency can occur due to inadequate dietary intake, increased requirements, poor absorption of certain medications. Like vitamin B12 deficiency, folate deficiency produces large abnormal RBCs. However, unlike vitamin B12 deficiency, folate deficiency does not typically cause the same type of neurological damage. Treatment involves correcting the underlying cause and replacing folate when appropriate. Sickle cell anemia is an inherited disorder caused by genetic change affecting hemoglobin. In this condition, RBCs can become rigid and take on characteristic sickle shape. These abnormal cells can break down prematurely, causing anemia, and they may block small blood vessels, leading to painful episodes and other complications. Sickle cell anemia is a lifelong condition that requires ongoing medical management. Treatments may include medication, supportive care, blood transfusions, and for selected patients, potentially curative treatments such as stem cell transplantation. Let's quickly summarize what we have learned. Iron deficiency anemia is commonly caused by insufficient iron or blood loss. Thalassemia is an inherited disorder affecting hemoglobin production. Anemia of chronic disease is associated with long-term inflammation or chronic illness. Aplastic anemia results from failure of bone marrow to produce enough blood cells. Hemolytic anemia occurs when red blood cells are destroyed too quickly. Vitamin B12 and folate deficiency cause megaloblastic anemia due to impaired DNA synthesis. And sickle cell anemia is an inherited hemoglobin disorder that causes abnormal RBCs. Understanding the type and the cause of anemia is important because treatment depends on the underlying problem. Anemia is not a single disease, it is a group of conditions with different causes and mechanisms. Thank you for watching this video. If you found this helpful, don't forget to like, share and subscribe to buy more classes for more educational video. See you in the next video.